Hi everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today we're going to talk about the current government shutdown and how you might be affected in healthcare. The government shutdown affects multiple federal agencies, even the ones that are, quote, essential, like Medicare, because even though the program does not shut down, the workers in the program could be laid off. Therefore, you will see some delays, and we're going to talk about that today. The normal function of Medicare claims is you submit it to your MAC, right? You send it to your Medicare administrative contractor. They process the claims, review the claims, pay the claims. However, they rely on people who are employed by CMS, the federal government, and the funds from the federal government to process and pay those claims when things come up. Therefore, if you have any kind of interruption to the normal flow of how this works, the baseline operations, you're going to see a delay. The government has only been shut down for a week, so chances are you probably don't feel anything at the clinic right now. But moving forward another week, 2 weeks, 3 weeks, you're definitely going to feel it. And it just depends on how long it takes for the government to get back to normal operations that we will see the full impact of what the delays are going to cause. Again, Medicare is still considered an essential department in the federal government, so it doesn't shut down completely. However, it does rely on CMS for oversight, payment, things like that. And if the staff who oversee those specific responsibilities are furloughed or laid off without pay, like they are right now, then things are not going to move forward as quickly as possible. You might try to call the customer service and it's not getting answered. You might have submitted an enrollment through PECOS or something like that, and you haven't received any response, and it's odd for it taking this long. You might be waiting on some audit results or something. All of these things are departments within Medicare that are not functioning as usual because of the shutdown. Claims are still processing, payments are still going out. However, they have sent a notification that it is going to be delayed. It's not going to be as quick as it usually is. Therefore, you need to anticipate this in your funds coming in and payments being posted and things like that. Once the government is up and running again, you will see them get caught up eventually, depending on how long the shutdown lasts. But it is going to probably go into feeling the effects next month, even 2 months, depending on how long it lasts. And you need to be smart with your business financials and forecasting. I had somebody recently ask me if they felt that we should hold Medicare claims and not submit them. I said, no, submit them just like you normally would as soon as possible, because they are still processing them, and they process them in the order in which they are received. So once the government shutdown is resolved and they start processing faster, they're going to process wherever yours are in line faster. If you wait to submit them in bulk, later on, who knows how many claims are going to be ahead of all of yours. At least you'll have money trickling in as they process instead of waiting for some bulk processing and adjudications and payments later on. I looked up a little bit of information just to give you some statistics about this, and I was told that up to 40% of the Health and Human Services and Centers for Medicare and Medicaid Services employees are furloughed. So that means there's only 60% still working. And being furloughed means that they cannot work, respond to inquiries, or process certain paperwork. And this affects everything from provider enrollment to claim error solution. So any reconsiderations you've opened, appeals, those are probably going to sit there quite a while. They have divided essential versus non-essential work. So the essential work, like I stated, continues, which is the core claim payments, emergency public health operations, and ongoing audits that were already in process when the shutdown happened. They're not starting any new ones. The non-essential work is suspended, and that is enrollment updates, appeals processing, prior authorization requests, and new pilot programs. So it's going to be creating some bottlenecks for sure, because if it requires the human oversight on a certain task and it's still operating, but there's less people to work it, or it's not being worked at all, it's going to be a longer lasting effect. Okay. Delayed claims adjudication, the core payment systems remains live, but it's slower, especially for complex or corrected claims. Hopefully you can have simple, clean claims go out the first time and they'll get paid faster because they're simpler and they take less time, okay? But if you have complex claims, high dollar claims, something that has been corrected and resubmitted, it's going to take longer. And then it says providers might experience multi-week payment lags disrupting cash flow. So again, make sure that you're anticipating that when you're running and purchasing any financials in your practice. The shutdown halts administrative appeals and redeterminations, which is really too bad. It also means that denied claims can't be corrected or paid until government resumes full operations. So anything that you have sitting out there that has been an appeal, a redetermination, corrected, it's gonna have to wait, okay? Provider enrollment, so new provider applications, reassignments, or group enrollments in PECOS may be paused. And this affects new hires, locum tenens providers, or organizational MPI changes. If telehealth flexibilities require ongoing CMS approval or rulemaking, which I know a lot of us were hoping that maybe they would extend the flexibilities until they could put in a better permanent rule than reverting back to the pre-COVID guidelines. Well, that didn't happen, right? So telehealth guidelines as it sits right now are pre-pandemic guidelines. And I did a video on this. I encourage you to look it up if you're not aware of that, because there is a chance you might not get paid for telehealth services. There is still a possibility that when session resumes, they could extend the flexibilities or reenact the flexibilities until the end of the year and pay any of the telehealth visits that have happened between October 1st to this decision or end of the year, whatever they extend it to, but it's not a guarantee. So it is a little bit of a gamble if you're still doing telehealth and you're banking on the government when they resume to extend the flexibilities for after COVID guidelines. Then, it is a gamble. You might not get paid, you might get paid. Nobody has a crystal ball right now to be able to tell you how it's going to happen, so you are taking on that risk yourself. And then, even though commercial payers are not part of Medicare, a lot of commercial payers follow Medicare guidelines, so there could be a ripple effect if they follow Medicare's payment guidelines or their reimbursement models, etc. If it goes on too long, there is a possibility there could be a ripple effect down to the private payers, commercial payers, but we just don't know that for sure, but it's just something to keep in mind. So just as a recap, Medicare continues to work, but it's going to be working a lot slower. You need to anticipate fewer payments spread out across larger timelines in your practice. If you're hoping for that money, I wouldn't rely on that money right now. And if you see a deficit in payments overall in your practice while this is happening, that is why. Make sure that you're still submitting claims. Make sure they're as clean as possible so they have a higher likelihood of being processed faster than complex or claims that you're going to have to resubmit corrected. If you're waiting on any provider enrollments, appeals, reconsiderations, just know that there's a chance that those will not be worked until the shutdown is resolved. And if you have any questions or comments about this, I would go to the cms.gov website to see if there's any updates that they can provide to you. Also, if you haven't signed up for their newsletter, I have mentioned that in past recent videos as well. I encourage you to go sign up because that's where you're going to get the most updated news. I hope that this doesn't go on too long, but if it does, this is just to bring awareness, very high level overview video to keep in mind how it can affect your practice and to see what things you can do internally to try to make it a little bit better if possible. If this video was helpful, please smash the thumbs up button, subscribe to my channel if you haven't already, and share this with your colleagues whom you feel would benefit. I appreciate the support, and we will see you next time. Bye-bye.